The standard playbook for corporate social responsibility in healthcare relies on high capital expenditure. Corporations fund the physical infrastructure, building clinics, pouring concrete, and outfitting wards with medical machinery. It provides a visible return on investment. A new facility offers a tangible asset and an immediate public relations victory during the ribbon-cutting ceremony. We can closely examine Tanah Bumbu, a major industrial hub in Indonesia, as a baseline for this physical investment model. Corporate and government entities have established a massive operational footprint here, comprising 14 regional frontline clinics and 1 central hospital. This regional map clearly illustrates the critical achievement. 100% of these frontline clinics have secured formal medical accreditation. For an ESG strategist looking at a spreadsheet, the logic seems secure. Fully accredited, highly equipped infrastructure should yield optimized public health. But treating physical capacity as the finish line of healthcare investment creates a very dangerous blind spot in public health strategy. If we cross-reference that pristine infrastructure with the actual clinical outcomes of the local population, the data reveals a disconnect. Looking at the region's health profile, roughly 25 tuberculosis patients fail to cure every year, despite having full access to the necessary medication. Preventative cervical cancer screenings have stalled at less than 2% of the target demographic. This split-screen comparison reveals the gap. While investment rises on the left, outcomes on the right remain stagnant. Maternal mortality remains uncontrolled, driven largely by delayed referrals and hesitant decision-making by families. These failures are not caused by a lack of medicine, nor a lack of available clinical space, or a lack of medical knowledge among the staff. The system breaks down at the final mile of healthcare delivery, the interpersonal communication between the medical worker and the patient. A state-of-the-art hospital yields zero return on health outcomes if the clinical staff cannot successfully and empathetically convince a hesitant patient to take their daily medication or accept life-saving care. In a clinical setting, poor communication represents a systemic efficiency leak rather than a simple customer service failure. Consider the massive burden of chronic disease in Tanah Bumbu, where nearly 100,000 residents are currently managing hypertension. Clinical coverage, simply giving these patients access to a doctor, has no impact without patient adherence to the long-term treatment plan. Looking at this patient journey flowchart, the failure point is clear. A rushed nurse delivers jargon-heavy instructions. The patient leaves confused, hitting this structural failure node, treatment dropout. That dropout node forces the patient back to the beginning months later, requiring expensive emergency intervention. This dynamic creates extreme variances in the quality of basic health education across different clinics. Without assertive, empathetic communication, patients become passive participants in their own health, driving up the volume of unnecessary readmissions and overloading the medical network. For corporate strategists, the challenge is how to operationalize and scale a subjective human emotion like empathy across an entire network. The solution is not a temporary motivational seminar. It requires the installation of a permanent operating system for human behavior. The EMT framework uses 3 interlocking components to standardize delivery. First, empathy installs protocols like SBAR and spikes for precise handoffs and critical news. Second, mindfulness builds mental resilience to prevent worker burnout. Third, technology integrates generative AI as an immediate translation engine. Using specific prompt engineering, a nurse can instantly convert dense biomedical jargon into structured, highly persuasive, and culturally relevant educational templates for their patients. The EMT framework upgrades healthcare workers from clinical technicians into highly effective, data-backed behavioral influencers. To justify funding this system through corporate ESG channels, we must mathematically prove the value of investing in human software over physical hardware. We evaluate this using the cost avoidance model, calculated directly from standardized Indonesian healthcare financing metrics. Program success is not measured by the number of nurses trained. It's measured by the exact monetary value of the catastrophic medical interventions we prevent. This ledger maps the macroeconomic projection. Increasing hypertension medication adherence prevents 25 strokes, avoiding 1.25 billion rupiah. Improving cervical cancer screening saves 2 billion rupiah. Adding savings from reduced tuberculosis dropouts and improved breastfeeding, the total potential is 6.62 billion rupiah in annual avoided costs. To maintain strict financial integrity, the model is prudent. It conservatively attributes only a fraction of those macro savings directly to the communication training. Even with that conservative filter, the calculation mathematically guarantees that corporate investment in clinical soft skills yields a multiplying return on investment. This methodology moves the corporate approach to social responsibility away from traditional philanthropy. As this comparative infographic details, physical donations, like buildings and equipment, are depreciating assets, requiring the corporation to act as a permanent, unending donor. By installing systems, AI prompts, and standardized behavioral protocols, the corporation creates an appreciating intellectual asset. This provides a clear exit strategy. Once the framework is installed and local government takes ownership, the corporation can step away while continuing to reap the reputational rewards indefinitely. It transforms CSR budgets from disposable charity into rigorous, high-yield investments in human capital. A highly advanced physical medical infrastructure is ultimately silent and sterile without the living, breathing architecture of human connection. The framework upgrades the actual mechanism of how a patient is healed, ensuring the physical infrastructure achieves its intended purpose. Investing in the precise, empathetic communication of healthcare workers today is the only way to build a resilient, efficient, and human public health ecosystem for the future.